Hi everyone, this is Alex Horn. To remind you, my research question is, are providers satisfied with their EHRs, and is there a correlation between provider EHR satisfaction, patient care, and quality documentation within the EHR? So for this week, we're supposed to summarize our research proposal and take what we got with our feedback and make changes as necessary. So first, I'm going to discuss the state of literature around the topic, so when I was researching my question. And like I said in the previous weeks, researching my question was really interesting just to see how other researchers were able to set up their questions and how they conducted their study and how they displayed and communicated their results. And during my research of my question, like during the literature review, I found articles that pertain to provider EHR satisfaction, including one that included the survey tool that I am going to use with some modifications. Many of the articles stated that additional research is needed to be completed on this topic to better understand providers and their satisfaction within the EHR system and what can be done to improve the satisfaction, whether it's additional training, different types of training provided, like peer training, on-the-job training, classroom training, hybrid of the different trainings, etc. Also, whether changes in the EHR system to accommodate providers' workflows is necessary, and then also looked at the patient perspective of EHRs and how they're affected. And a lot of the articles stated that a provider's use and satisfaction with the EHR system may correlate with patient satisfaction with the EHR system. So I also found it very interesting that, so originally I was not going to look at the patient perspective. I was just only going to focus on the provider perspective. But after reviewing my question and reviewing the research articles within the literature review, a lot of the articles discuss the patient perspective and along with the provider perspective. So majority of the articles stated that providers' attitudes towards their EHR was positive, so that is good. Additionally, majority of my articles, or all of my articles actually, are from before COVID, and the most recent article was from April 2019, so it was published right as the pandemic began. And I think it would be interesting to assess provider satisfaction of their EHRs post-COVID and how their perspective has changed through the stress of the pandemic. And it's interesting because in the article from April 2019, that's the one with the survey tool, I believe I will be, if this study was actually conducted, I could take their results and compare them with what I would achieve with my results and just see how it changes. So next, I'm going to talk about my hypotheses or hypothesis. My hypothesis and logic for my research is that providers are going to be somewhat satisfied with their EHRs, especially now that it's post-COVID. I believe that providers will point out great things within their EHR, for example, patient and provider communication through the patient portal, but also actions or items that need improvement within the EHR. And one that comes to mind specifically is interoperability with other systems and with health information exchanges that was listed in the literature review. With this, I think there will be a positive correlation with EHR satisfaction, patient care, and quality documentation within the EHR. Because for a provider to provide quality patient care, there must be documentation, quality documentation at that, written on the patient. And without the documentation, errors can be made, tests could be reproduced when they don't need to be, and attribute to waste within the healthcare system, etc. So I think providers who are more satisfied with their EHR will provide better documentation on their patients, and therefore their patients will have better care. So then I'm going to move into my research methodology, study design, and how I would collect my data. Like I said, while researching my topic and questions, I came across a survey study published in April of 2019 before COVID, and they used a survey tool sent to providers. And I'm hoping to use this tool with modifications to questions to make it more user-friendly and to obtain the information that I want to obtain. So the questions on this tool already, without modification to them, include demographic information. So how many years are you in your current role? What exactly is your current role as a provider, like a resident, a fellow attending, etc.? How many years have you used any of the following: any EHR, Epic, or Epic at that organization specifically? The next question is, what parts of Epic do you use at the organization? And that would be a select all that apply. How does Epic affect your patients overall, with a scale of extremely negatively to extremely positively? How does Epic affect you overall, with a scale of extremely negatively to extremely positively? Please rate your efficiency using Epic with the scale of extremely inefficient to extremely efficient. And please rate your efficiency compared to your peers, so those in the same specialty or subspecialty using Epic, with a scale of extremely less efficient to extremely more efficient. And some of the feedback that I received from our discussion boards was that maybe discussing EHRs as a whole, or just being very broad with EHRs, could be just too much. And so I felt that since Epic is a very common EHR system that is used in a lot of different organizations, that I would focus on Epic. And also, this is what this survey also focused on originally too. And so then we could get that comparison of data. Additionally, this survey had open-ended responses as well. So describe the most positive effect Epic has on your patients. Describe the most negative effect Epic has on your patients. Describe the most positive effect Epic has on you, and describe the most negative effect Epic has on you. So again, I would propose making some changes to the survey to make it more user-friendly. And the changes that I would make would be the format of the Likert scale. So I would still keep this scale of extremely negative to extremely positive, or extremely less efficient to extremely more efficient, but I would give a scale from 1 to 5 to those. And instead of rating like, I'm about here, they would have to choose the number 1, 2, 3, 4, or 5, and that would give us a better definite answer. And I would add the following question of, on the scale of 1 to 5, from 1 being extremely dissatisfied to 5 being extremely satisfied, how satisfied are you of your EHR? Additionally, this is a new addition from receiving feedback from the discussion board. It was noted that I didn't have anything for the patient's perspective, which does play a role in my question. And so I would include a survey geared towards patients with their demographic information, just basic information, kind of like with the providers. Ask what aspects of the EHR, which would be Epic, do you as the patient utilize? Is it provider communications? Is it appointment scheduling? Is it accessing your medical records? So those are just some examples. How does the EHR impact you as a patient? How do you believe the EHR impacts your care from the provider? And these questions would be on a Likert scale, similar to the ones in the provider survey. And I will also have open-ended questions similar to the ones of the provider survey of, describe the most positive effect Epic has on you, and in parentheses, the patient. Describe the most negative effect Epic has on you, the patient. Describe the most positive effect Epic has on your provider and the care you receive. And describe the most negative effect Epic has on your provider and the care you receive. So from this study, like I've said, I could compare the data pre-COVID to post-COVID and see if COVID has had any impact on these questions, while also answering my question of if providers are satisfied with their EHRs and if there's a correlation between provider satisfaction and quality patient care and satisfaction. So that's basically the majority of my research proposal. I look forward to your all's feedback, and thank you so much.